title of this module is Domestic Violence and Child Abuse. And the objectives are, first, to define domestic violence and child abuse. Next, to describe the prevalence of domestic violence and child abuse. And finally, to discuss some of the mental and physical health consequences of domestic violence and child abuse. The Department of Justice defines domestic violence as a pattern of abusive behavior in any relationship that is used by one partner to gain or maintain power and control over another intimate partner. And this can take a variety of forms. It can include physical or sexual violence, emotional or psychological abuse. It can include attempts at economic coercion, as well as threats. Approximately 10 million adults will experience domestic violence each year in the United States, with over 20,000 calls to domestic violence hotlines on a typical day. 1 in 4 women will, at some point in their lifetimes, experience severe intimate partner physical or sexual violence or stalking, as compared to 1 in 9 men. Now, in some instances, this domestic violence can lead to intimate partner homicide. It's estimated that 1 in 2 female murder victims were killed by an intimate partner, as compared to 1 in 13 male murder victims. And not surprisingly, the presence of a gun in these domestic violence situations can dramatically increase risk for homicide. Domestic violence has a variety of negative consequences on mental and physical health. It's associated with higher rates of depression, anxiety, and post-traumatic stress disorder. Individuals who are experiencing domestic violence are more likely to engage in suicidal behaviors and to meet criteria for substance use disorders. Domestic violence also increases risk for the development of chronic pain conditions, for gastrointestinal symptoms and functional GI disorders, and it's also associated with increased risk of contracting HIV or other sexually transmitted infections. Domestic violence affects not only the intimate partners themselves, but in many cases it also has an impact on children. So each year in the United States, it's estimated that 1 in 15 children will be exposed to domestic violence, which amounts to over 5 million children a year. And children who are exposed to domestic violence, who witness it, are at increased risk for a variety of problems, including generalized and separation anxiety. These children are more likely to have difficulties falling and staying asleep, in part due to having more frequent nightmares. They're more likely to engage in aggressive behaviors with peers, to have difficulty concentrating, to report feelings of worthlessness or powerlessness. And in the long term, these children are more likely to have problems with violent behaviors, as well as health problems, including obesity, heart rate disease, and increased risk for depression and substance use disorders. Now, according to the Child Abuse Prevention and Treatment Act, child abuse can be defined as any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse, or exploitation, or an act or failure to act which presents an imminent risk of serious harm. And there are different types of child abuse. There's physical abuse, which involves the intentional use of physical force that can result in physical harm. There's sexual abuse, which involves pressuring or forcing a child to engage in sexual acts. Emotional abuse, which involves behaviors that might harm a child's sense of self-worth or emotional well-being. And neglect, which includes failure to meet a child's basic physical and emotional needs. Now, about 1 in 7 children in this country will experience child abuse and neglect within the last year. And approximately 1,800 children died of child abuse and neglect in the U.S. in the year 2019. Now, rates of child abuse and neglect are significantly higher, as much as 5 times higher for children living in poverty. And recent evidence, emerging evidence from the pandemic lockdowns suggests that these lockdowns resulted in a tripling of rates of child physical abuse. Now, child abuse has not only a negative impact on the children themselves, but also on the country as a whole. It's estimated that in 2015, child abuse and neglect accounted for over $400 billion in economic burden. Now, childhood sexual abuse is quite common as well. 1 in 10 children are estimated to be sexually assaulted. That translates to every 8 minutes a child being sexually assaulted. And of those children, about 1 in 5 will experience their abuse before the age of 8. Now, many of these children, in fact most, will never disclose their sexual abuse. It's estimated that 38% of children will disclose. And there are a variety of reasons why this may be the case. Children may not want to disclose due to threats and coercion from abusers, due to feelings of shame or guilt, due to concerns about not being believed, as well as by fears of being removed from their homes. Child abuse can have a variety of negative consequences on mental and physical health, many of these similar to domestic violence. Children who experience abuse are more likely to develop mood and anxiety disorders, to develop post-traumatic stress disorder, problems with conduct, as well as to report suicidal ideation and attempts. These children are also likely to experience injuries that are, in some cases, a direct result of their abuse, also to report chronic pain, to develop gastrointestinal symptoms, failure to thrive, as well as obesity. There are a variety of different potential indicators of child abuse and neglect that were outlined in an article by Lieb, Lewis, and Zolotor in 2011, and these vary according to abuse type. For physical abuse, these might include patterned skin injuries, such as those caused by irons or teeth or cigarette burns, bruises on fleshy body parts, or abusive head trauma. For sexual abuse, these indicators may be STDs or sexualized behavior in prepubertal children. They may include somatic symptoms like dysuria or enuresis, as well as oral injuries. Potential indicators of neglect may include failure to thrive or failure or delays in seeking medical care, school failures, and poor hygiene. And potential indicators of emotional abuse might include mental health problems, eating disorders, somatic symptoms, as well as behaviors observed directly in the course of healthcare visits, such as belittling of children. Now, it's important to indicate that this is not an exhaustive list of indicators, nor are these indicators specific to child abuse and neglect. They're merely warning signs. For additional information on domestic violence, I recommend visiting the website of the National Coalition Against Domestic Violence. For additional information on child abuse and neglect, I recommend accessing the annual reports that are released by the U.S. Department of Health and Human Services, as well as accessing the other modules within this block of stress and trauma-related disorders.